To the week 6 necropsy video. This is going to be a little bit of a different tutorial. Rather than having a quiz, what we're actually asking you to do this week is actually to watch this video, which will prepare you for your fish necropsy, which you're doing next week. So you can actually take right now your manual and follow along with me as we quickly go through these pieces. A little forewarning, I'm not going to take all the samples that I'm going to ask you to in the manual. There's just again, some of them we've already done before, and again, for the timing of this video, it just doesn't make sense. So for some things, I'll just tell you what I'd like you to do, starting right now. When we get our fish, of course, the first thing we're going to do is take our length and weight measurements, calculate K-factor, and then start examining the outer skin. We're going to be looking for lesions on both sides of the fish, right, around the anal pore, places around the operculum, right, checking to see that all pieces of the fish are in good shape. Now, one of the things that we want to do, of course, is examine the inside of the mouth. We want to look for bleeding. In this case, we want to look for contusions, which you can see present here on the side of the face. Again, all of these pieces of evidence we'd be writing and recording under body surface. We're going to have you make a skin swab dry mount. Okay, we're going to be doing those pieces and then a scale wet mount as well. I'm going to ask you to take it and collect a few scales, which you can do by just taking your scalpel and peeling a few scales back and then putting it on a slide with water and then making a wet mount. One of the things I'm going to ask you also to do is to remove the caudal fins. So again, when we spread out the tail, we can see there's some wearing present here on the fish. So we're just going to simply remove part of the fin lobe, okay, and remove it and take it away. Then I'm going to ask you for a thin square of skin. Now I'm asking you to look for any places where you notice there's lesions. In this case, the skin of the fish looks relatively healthy, so I could just go anywhere on the fish and just take a small square of skin, place it in a label whirl pack, and consider that well done. I'm going to remove the operculum, just like we've practiced before, so I'll cut that off, cut that away with scissors, okay, just to remove that lobe. Okay, exposing, in this case, some very red, inflamed, and necrotic gills. Okay, so I'll take a gill wet mount of this, just like we've done previously, and then look for parasite loads. Now, going into the eyes, one of the things we've asked you to do in this case is to take out one of the eyes. Eyes are very tricky to remove. They are, of course, movable. You can see here, I'm just playing around with them. It might take some practice at removing them. So in this case, it's mostly trial and error. It's not necessarily an easy procedure, but you have to take the scalpel under, sort of move it all around, sever the optic nerve at the back, and then pull out the eye. Sometimes there is damage to the eye that happens, and again, in a frozen fish, that's sometimes unavoidable. So here I'm just going to remove the eye. Okay, and I would take this sample, this one's being a bit fussy, remove the eye and put it in my label whirl pack. Okay, so that's the one way we do it. Now in your book it's telling you to make 3 cuts to actually enter the inside of the fish. We want to do essentially the isthmus, okay, so just behind the pectoral fin. So we want to just move that fin out of the way. We want to essentially make a window. So we're going to go straight here, straight across the lateral line, and then down to the anal pore. So we will have to cut into the fish, which depending on the species may be more or less difficult. Okay, we've given you relatively small fish, so they should be easier to do. So we'll just cut in through here and lowering down to essentially make a window into the interior cavity of the animal. So we'll just take our scalpel as best we can, clean up the area, and then cut into it. Now we will have to cut through the ribs, okay, exposing the inside. Now here, what I've done is I've pulled away and I'm seeing the remnants of the ribs here. You can see along the back wall. You can see all the muscular tissues here. I can see where we've popped or has popped the swim bladder. I can see the kidneys in behind there. And I can see in this particular animal that I'm a little bit shy of being able to see all the organs. So I'm going to just make a little bit further of a cut north, anterior towards the head, and remove a little bit more of that tissue so I can get a better view of this animal. Okay, open it up, and there we go. So we want to open up this area, and now I can start to see the internal organs. So if you move around the mesentery, some of the things I'm looking for, of course, right off the bat, I have my landmarks that I follow: spleen, intestines. We're looking for the sex organs. We're also going to be looking for the liver. In this case, and I'm not entirely sure if it's visible on the video or not to some detail, you'll probably have the experience to do it. If you look at the liver of these particular fish, you'll notice they're covered in a granular-like appearance. These are all lesions that we really want to take particular care of. We'll talk more about them in the lab component when you get here, but these are of course very important. We want to find a number of things present. So we've got liver, we've got our spleen, intestines, we flip it over, we see the stomach on the other side. If we go far up here, I can see the heart present just at the top of the anterior to the head, and the other organs that we need to. So again, how we would start going about it now is we want to tie off both ends of the fish. We want to do that for a couple of reasons. We want to make sure that any of the food present in the stomach doesn't accidentally squish out, because we were going to get a stomach contents sample, and we also want at the rear end as well that nothing escapes. So we would tie that off with the string that's provided in your manuals and then remove them. Some of the organs that we're particularly interested in, as I mentioned, is the liver. This one is usually in fish where we see most of the parasite load. We see, in this case, lesions present here. We'd want to be able to look for that as well. We take out all of these organs, okay, looking extra special for all of the different pieces. In your manual, after you've taken all the samples, you're going to be collecting a sample of the vertebrae. So we'd cut through the backbone of the fish, expose some of the kidney, which can be difficult to acquire from a sample point of view, but we do the best we can. Cut through the vertebrae, take 2 of those, and then we'll cut into the head, try and remove the brain, and then finally the otoliths. So again, the fish necropsy can be done relatively quickly. We'll get very good at it in the lab this week. And then of course, what takes the longer is the actual sample analysis, which you'll be doing in the lab as well. Thanks very much for listening.